Welcome, everyone. So hopefully you all had an opportunity to sign in at the front and of course take some of the literature today. There will be presentations on the information. But before we get started, we'd like to welcome everyone and please ask for any community representatives, concerned citizens, or leadership in the city of Cleveland, the Adams Board, the Cleveland Division of Police, or the DOJ to please stand and identify yourselves. That's you. Well, no. You're presenting. You can sit down. We can wait. You got your whole introduction comment.
No, she needs me. Division of Police. Chairman of the board of the Adams Board. Michael Donovan, Department of Justice.
And we have DOJ, you already spoke, and we have monitoring team representatives here as well. So if you'd like to just stand so people know who you are. Thank you. Thank you. And are there any community organizations in the audience today that want to be identified? Thank you. Anyone else?
Family member, side member,
Thank you. So we always like to begin by recognizing anyone who has come to invest their time, intellect, attention, and passion towards police reform. We know that we cannot do this in a silo, and so we want to encourage you to continue to participate, to engage, and of course to give us any solutions or advice you have to improving this process. We have a presentation today on crisis intervention training by the Mental Health Response Advisory Committee, which is a part of the Adams Board. We also have, with that presentation, members of the Cleveland Division of Police and the City of Cleveland. So at this time, I would like those members to please stand and introduce yourselves and begin your presentation.
You're the clicker? All right. All right, good evening, everyone. How are you? Thanks for coming out. My name is Scott Osicki. I'm the Chief Executive Officer of the Adams Board of Cuyahoga County. And this is Mr. Ed Eckert.
Hi, good evening, everybody. My name is Ed Eckhart. I'm the Assistant Director for the Department of Public Safety for the City of Cleveland.
Captain James Purcell, I'm the CIT Coordinator for Cleveland Division of Police.
All right, thank you. So what we first want to talk about is the Mental Health Response Advisory Committee and what it is. So it was actually developed in September of 2015 to provide feedback, technical assistance, and support to the Cleveland Division of Police as it relates to the coordination of crisis intervention activities in Cleveland. The City Department of Police, Cleveland Division of Police, yes, and Ed Eckert's department and the city selected the Adams Board to be the lead of the Mental Health Response Advisory Committee, and we are the tri-chairs of the committee. So there was a memorandum of understanding that was developed between the city and the Adams Board to carry out the duties of the MHRAC. And we'll just call it MHRAC from now on, just to keep it short. So the goals and objectives that we have. The first is fostering better relationships and support between the police, community, and mental health providers. Identifying problems and developing solutions to improve crisis outcomes. Providing guidance to improving, expanding, and sustaining the CDP Crisis Intervention Program, the CIT program. And conducting a yearly analysis of incidents to determine if the CDP has enough specialized officers, if they're deployed effectively and responding appropriately, and recommending changes to policies and procedures regarding training. Then continuing on with the goals and objectives, was to facilitate an ongoing dialogue with a diverse group of professionals, people receiving services, and family members regarding police interaction in the community, and then to serve in an advisory capacity to the City of Cleveland and the Adams Board by making recommendations on a variety of topics related to police interactions with the behavioral health community. So every year we are required to produce an annual work plan, which we do that. And we submit that work plan to the DOJ in the city, and it kind of outlines what the Mental Health Response Advisory Committee will be doing for the year. So it kind of sets our committee goals. And then we also submit an annual report every year to the City of Cleveland and to the Adams Board. And all of the reports are there throughout the years, pictures of those, and they're available on our website. So if you go to our website, www.adamhscc.org, and you scroll down and there's a DOJ tab on there, and you click on that, and there are, the meetings are posted there, as well as the annual reports, the work plans, and other documents such as trainings that we have. We are actually a model for others. So the monitoring team likes to tell other cities that's going through similar things about the successes of the MHRAC. And we also like to present at various conferences that we get invited to. And Carol Ballard, our Director of Training, and Captain Purcell, they're mostly our presenters at the conferences. One was an annual Crisis Intervention Team International Conference. One was the Ohio Annual CIT Advanced Training Conference. One was the Ohio CIT Coordinators Training, the Ohio Dispatch Train the Trainers Sessions, National Association of Civilian Oversight of Law Enforcement Regional Meeting, and the Case Western Reserve University Social Work Conference. So the committee, in order to get its work done, and all the work is our volunteer efforts from everyone on the committee. We started out with a real big group, but then as people, like their projects ended, they would move on to other things. But we still hear a lot from other people who haven't been on the committee for a while, but you know, they do keep in touch with us. So is this your turn to do that next? Yes, all right. So I'm going to introduce Ed again, and he's going to talk about the various committees.
Thank you, Scott. One thing I wanted to just highlight for you all is how impressed I personally was when I first got involved with the Adams Board and all of the work that they had already been doing even prior to the consent decree and the discussion between the city and the Adams Board about how they could help us in terms of making recommendations for training and other law enforcement interactions. There are literally hundreds of people from all different disciplines, both in mental health, social services, that give their time so very freely on a regular basis to provide recommendations and to really make the training and education for our Division of Police and Law Enforcement such a valuable tool. The first meeting I went to, the Adams Board in that big conference room, it was literally filled with about 85 different professionals, again, that just took their time to come and provide input to what the Adams Board and the City of Cleveland were about to embark on. So as Scott said, we did finally come up with a structure as part of the Memorandum of Understanding between the city and Adams. And part of that was to separate a lot of those people and their specialties into subcommittees of the MHRAC in an effort to try and focus all of their efforts to make impacts into some specific areas. The first committee that we'll talk about is the Community Engagement Committee. They actually came up with some resource cards that have been issued now to all of our officers out in the police districts. And here in a second, we're going to show you an example of that card. But that gives our frontline officers an instant resource that they can go to when they interact with somebody about what they could potentially be referred to and give them numbers to follow up on. Now, we obviously have some work to do in terms of making those resources available 24/7, and we recognize that. But this was a huge step in just getting that information out to our frontline officers. The committee also put together a presentation for the community on when to call 911, and they also provided that training to behavioral health providers and others. Because often what we found is that somebody may be having a mental health crisis, they go to a mental health provider, and that situation may escalate, and 911 is then called, and then police officers show up. Well, we needed to educate the behavioral health professionals on not only why and how they should be using the 911 system, but also ways that they can assist law enforcement when they respond out to the scene. What we didn't want to have is somebody calling 911, turning their back on the person that they may have been counseling, and then making police officers be the quote-unquote bad guy because they're there now to take somebody away. We wanted to stimulate dialogue between Adams, the Mental Health Response Advisory Committee, and law enforcement to try and bridge that gap, and we think we've been pretty successful with that. And then lastly, they've implemented ongoing dialogue regarding the use of social media. Social media is just so prevalent nowadays, and it's very pertinent, especially with the younger population, in being able to get our message out, so they've been very active in that regard as well. This is actually one of the resource cards that I talked about. Each one of our police districts has a card with the social services and resources available to them in their district. And that was part of the committee's work. As I said earlier, we would like to be able to expand these resources so that if there is a crisis at 11 o'clock at night, there's a resource open and available, and we are currently working on trying to enhance those relationships. Another committee that we formed was the Quality Improvement Committee. Obviously, one of the things that you always want to do is when you implement a new policy, a procedure, or a service, you want to make sure that we're providing that service in the best way possible and to get feedback from the consumers of that service. And that's really the role of the Quality Improvement Committee. It was formerly two separate committees, where it was a policy committee and then also a Quality Improvement Committee, and we brought both of those together. The committee is reviewing and discussing not only the effectiveness of the newly developed CIT program, but they're also making recommendations about what they're finding from that data. And that's what's really important, is we may think in a room that something may work and we implement it, but we have to make sure that it's actually being implemented the way that we thought it would, and it's having the impact that we hoped it would. So getting the data back is a way to help us understand that. They're working on reviewing and discussing the barriers to access to service, like I just mentioned. You know, not having a social service or an organization available beyond Monday through Friday, 8 to 5, is not helpful to a lot of people. So that's their task, to try and figure out ways of broadening that availability. And then lastly, they're working with our Division of Police to gather the data that they find during the CIT interactions between our police officers and the community to understand those types of individuals that we're interacting with, what are their needs, and what's the best way that we can serve them. Also under the guise of the Quality Improvement Committee, on the data sheets that I just spoke about, this is some of the information that we're gathering off of those interactions. The nature of the call, the referral source, the demographics of the person we're interacting with, any kind of mental health profile. Is there substance abuse involved, alcoholism, things like that? Do they have use or access to weapons? Tools and techniques that they use during their intervention, so that gives us feedback as to what, again, is working. Are the training that we're providing our police officers in terms of de-escalation, is that really helping? Is it de-escalating situations where we're having less uses of force and what I would call conflicts with the community? And then lastly, and this is very important as well, the disposition. Did the person end up going to jail? Did they go to the emergency room? Where else did they go? Because then that helps us to sort and identify, are there other services or resources that we can be using for those folks that we're having interactions with. Then the third committee we have is the diversion committee, and it is their responsibility to now figure out, are there other options for those individuals that our officers interact with in crisis other than taking them to jail. We found that a very high percentage of those interactions probably are not best served being incarcerated. Incarcerating them takes them out of the system and our ability to be able to manage an underlying issue that they might have, whether it be a mental health issue, a drug or alcohol issue, a social issue at home. So one of their folks is to really review and discuss different strategies to divert people in crisis. The other thing they're looking at, if you can go back one, please, is looking at the utilization of the existing resources we have. Like one of the examples up on our slide here is the Crisis Stabilization Unit. It's a unit where we can take people where they will be in a protected area, that they have some limited health monitoring there, but it allows behavioral health specialists to be able to go and interact with them in an environment outside of a hospital emergency room and outside of jail, so hopefully kind of act as an intermediary from those systems to keep the person as what I would call mainstream as possible, so that we can help de-escalate the crisis that they're in and get them back on track with their normal follow-ups with any physician that they might, or if they don't have a physician, it would be that unit's job to get them a follow-up. I think this is you, Jim.
Yeah, I can talk about this a little bit. So real quickly, when we're talking about diversion, we're always looking for new resources and new ways to divert people from jail and have them get mental health treatment as an alternative. So the latest thing that we've done is received this grant funded through Council of State Governments. The first one was a CIT co-responder model, which is something we're still looking at expanding into other districts. Basically, that's 2 social workers with 2 police officers that go out and handle crisis calls. And we found some really positive effects of that. They were really good at handling certain types of calls. They were excellent at dealing with individuals that are high utilizers of the 911 system and the mental health care system that frequently it was hard to find solutions for. They were very creative in finding solutions for those individuals to get linked to mental health services. And our new grant is funded through SAMHSA. It is a jail diversion pilot program. And that particular program is that Crisis Stabilization Unit that we talked about. It's a 24-hour-a-day, 7-day-a-week facility that provides a number of different services. It provides mental health services, housing. There's a psychiatrist there almost every day of the week, so people can get medication checks. They help link to mental health agencies and housing services. So for individuals that are really struggling, that the hospital might not be appropriate for, because the hospital tends to be for people in the that are the most ill, that are really suffering from a crisis of really epic proportions. This tends to be a little bit lower level, but it tends to get them linked in a longer term. And they don't actually, even though the people can stay there up to a week, they have follow-up services and they use peer support. So they use people that have successfully worked through the mental health care system and can now help others receive those services and get their lives back on track. So the next committee is the training committee. So goals are review, analyze, and make recommendations for CIT training. That includes our 40-hour specialized CIT training, which is just about finished now. That was completely retooled. We went over every bit of that training. We changed it a lot. We made it a lot more scenario-based to make it more realistic, to make it more usable for our officers. Our in-service training, so we did an initial 8-hour in-service training, and there's CIT in-service every year for all the officers. This year is actually going to involve strategies for youth, along with some policy things, but the strategies for youth was a really good program. It's developed for dealing with youth in crisis. And there's also training for our dispatch staff. How do they handle crisis calls? And what's the most effective way they can serve the public by handling those calls effectively and getting them the right resources. So develop and implement training objectives. We continue to do training for all our officers. We're looking at having CIT specialized officers at such a level that one will be available 24 hours a day for all our crisis calls. That's a goal we haven't reached yet, but it's a goal we're working toward. And these are specialized officers that are volunteers that want to take this training and want to handle these type of calls. You totally lost us. And talk about the training a little bit more. We're lucky to have the Adams Board, and we're lucky to have a lot of the individuals we have in our community, because we've had some of the best minds involved in this training committee to really develop the best training for officers. A lot of people have really stepped up and volunteered their time, knowledge, and expertise to create training that's really impactful on the way officers handle these crisis calls. So, training committee, so this is accomplishments, submission of the 40-hour specialized CIT training, the monitors for the City of Cleveland and DOJ in May 2019. That's a big goal because that's a tremendous amount of material, and it's submitted by many different individuals who have expertise in particular fields of knowledge, and was all put together and submitted for our new 40-hour specialized training. Created and implemented the 8-hour training responding to individuals in crisis. That was our original in-service training for Cleveland Division of Police. Also created and implemented 4-hour training, officer wellness in-service training. So it's training we're kind of proud of because we started looking at rates of stress and suicide and trauma with police officers. We want our officers to be the best that they can be to be able to better serve our community. So that was a big piece that we put together, and I think the officers really appreciated, and is also helpful to the community for that particular reason. Creating and pending implementation of responding to traumatized youth. That's going to be our 4-hour service training this year. That's starting at the beginning of July. And we saw some trends in some of our calls that were kind of disturbing surrounding juveniles and youth in our community. So we thought it was time that we actually address that with our officers. So that's our new one. We were actually just doing a train the trainer today because we have a lot of social workers and people that work with the youth in our community that are going to actually give the training and be able to give their expertise to the officers. Also created and pending implementation of active listening and responding to people in crisis for dispatch. So that's going to be dispatchers training on how to deal with individuals in crisis when they call and increase their verbal skills in dealing with those situations. You want to keep going?
I just wanted to, Carol Ballard, how many volunteers do we have that participate in the training actually to pull it off? Let's say the 40-hour training, which is 40 hours all week long.
So for our specialized CIT training, we usually have on the average about 65 volunteers. So they represent family members, consumers, our behavioral health agencies, some of our stakeholder agencies like the Board of Developmental Disabilities and so forth, Veterans Hospital. So it's a pretty big endeavor, but they come free of charge, they volunteer their time. Many of them have been part of the CIT community program for over 14 years.
Carol, we have the volunteers for the in-service trainings as well, right?
Yes.
And the
For our in-service training, in fact, we had our train the trainer session today for our topic called recognizing and responding effectively to traumatized youth. We have 13 volunteers. They represent our 5 largest behavioral health children's agencies in Cuyahoga County. We're very, very proud to have Belfair, Beechbrook, Applewood, Positive Education Program, along with Ohio Dog Stone. So this is very, very exciting to have them as part of our training program. Thank you.
So real quickly, I'll talk a little bit about the impact of mental health and law enforcement collaboration. One advantage we do have here in Cuyahoga County, in addition to our Adams Board, who's lent their resources to this project, we do have a lot of people that have stepped up, very knowledgeable individuals who have given their time and expertise to creating some of the work product that we have, creating some of the training, our policy. Policy is actually considered a model across the country as one of the more advanced and progressive policies as it pertains to CIT. And these individuals give their time, give tremendous amount of effort, and I would like to recognize them here now. There's a lot of different individuals, and when I start going through the list, you start really thinking about people that have very important jobs and have a lot on their plate that we're willing to give to our training and give their time to our policy to make it the best could be. So impact is increasing completion of crisis intervention team statutes. So every interaction we have with individuals in a crisis increases our knowledge a little bit of how the police handle those interactions and what those interactions look like. And there's follow-up done to target and see which individuals really seem to be utilizing those resources a lot. And we've really started to dig into, if we start to see a person's name 4, 5, 6 times, what's going on with this individual that we need to maybe reach out and get them some resources, or get them linked to an agency, or get them some kind of psychiatric help that they might need. Increase the knowledge by law enforcement regarding behavioral health resources. So in the past, police officers have tended to talk to individuals, de-escalated them verbally, and either left them in place at their home or wherever they were at, or took them to the hospital when it was a really serious mental health crisis. Now we want our officers to go a little bit beyond that. We want them to give them referrals to mental health agencies. So if I talk to somebody at midnight, there might not be a lot of agencies open. I can certainly give them a number for somebody to talk to in the morning. Those are really important, and linking people with the agencies and the help they need increases the overall well-being of our community. So increased collaboration on grants between behavioral health and law enforcement. We saw the 2 grants we've already done. In the past, I don't think law enforcement and the mental health agencies and the mental health community in general have really had the communication that we have since this has all started. I think that's been a huge plus, because they can kind of see the issues that we're experiencing, and we can start to understand some of the issues that they have and what their limitations are in dealing with these individuals. So we become a more collaborative effort in getting people the help they need, getting them to the right level of care. Also, increased collaboration and communication between behavioral health and law enforcement regarding services for people in crisis. So we do tend to take people to the hospital when there's serious mental health crisis. But officers are looking for other resources out there and becoming a little more sophisticated about the way that they have people linked with that mental health community. So there's more than one level of care out there for individuals, and it's not a one-size-fits-all. Trying to get people that proper level of care is a huge piece in trying to get them healthy. So moving forward in 2019.
Okay, so moving forward for 2019, enhanced data collection. As Officer Purcell said before, with the stat sheets, we're getting more and more officers filling that, and we're looking to enhance that as well, and to actually enhance that data collection. Eventually it will be electronic, we're hoping for, right? Electronic collection, and the transmission over to the Adams Board for working on that. Then expanded diversion strategies. Our diversion committee will be picking up this year, going forward now, at the end of the year, to really talk about those diversion strategies and to look at the diversion that's going on now with our SAMHSA grant, to look at that and to see if that could be implemented somewhere else or expanded. So that will be starting up again towards this fall period, summer and fall. Implementation of the 40-hour training specialized CIT officers. Captain Purcell is identifying officers that will be specialized CIT officers to receive that CIT training. And that training, you said, will begin again probably sometime within 2 months it's going to be starting. Yes, so we're looking forward to that. Ongoing implementation of in-services for law enforcement and training of the dispatch. We talked about that earlier. Increase in community engagement opportunities. Karen Kearney is here. If you raise your hand, she is our chair of our community outreach committee. So she is going to be coming up, and her group coming up with more ideas for community engagement opportunities. Continue to improve the mental health and addiction services continuum of care, address gaps of continuity of care in Cuyahoga County. So that's all about the mental health and addiction agencies working along with the police. Also taking the gaps that are identified from the various committees and working with the behavioral health community to try to fill those gaps moving forward. I also want to say that Dr. Clegg on the Police Commission, she's our liaison back and forth between the MHRAC and the Police Commission, so we thank her for her work. I see Rosie is here. She is a member, a very active member of our MHRAC. Is there anyone else here I'm missing? Oh, Reverend Golston, of course, he is a member of the MHRAC as well. I can't, tell me. Yolanda Green, Yolanda Green. And then we have, let's see if it, oh, Marcia Blanks, yes, thank you. So we're glad that you're here and we're glad for your volunteer efforts. So on the next slide is just for folks if they want more information on the Cleveland Division of Police. I know it's a really long web address, but if you just Google it, it'll come up. The Adams Board of Cuyahoga County, there's a lot of information on there. There's the Cleveland Police Commission. You could also just Google them, and they have a lot of stuff on their site as well. And then the U.S. Department of Justice also. So if you want to go there to find out any more information about any of this, you could do that. So that was our presentation to you.
Thank you. So let's give them a round of applause. So we are going to move into our public question and comment period. So if you have questions specific to CIT or MHRAC, you can ask that there, and we'd ask that the presenters, if you have the answers, to provide those to the community members if those questions arise. Okay, thank you. So, questions? Oh, Ms. Bickerstaff?
Okay, the question that I have is, I see that you said you have things that can help de-escalate situations out in the community. Do you have any type of program that you have that you could collaborate with the Cleveland Police Commission for accountability or mental health for officers that deals with high-strung situations every day? Because I attend all of their accountability meetings. I've only missed 2 in the last 3 years. And in the accountability meetings that we have, we talk about things about de-escalation or stop things before they get started. Do the county have any type of program or some type of strategy that you could come up with that also, or is it in the making, or do you think it's necessary, or would you collaborate with the Cleveland Police Commission?
Okay, well, that's really a lot of questions. But I will say, as far as officer wellness and mental health, we did do a piece last year that was really well received.
And part of what we did was the same thing we're doing here with the community was offer officers a variety of resources, because it's not one size fits all. And police officers are human and they have the same issues everyone else has out in the community, and they are in a high-stress job. And the infamous saying is, you can't pour from an empty cup. So if the officer doesn't have resources, he's having issues himself, it's really hard for him to solve these issues out in the community. So what we did was offer a number of things. We talked about private resources, medical doctors. We talked about some educational programs, some stress relief programs that the department has currently implemented. We also talked about our stress consultant. We have a psychiatrist that works full-time with the police department. And we have an employee assistance unit of people that deal with issues of mental health for police officers. And we also had a new program that we just kind of implemented that was retired and some on-duty officers. It's kind of run by one individual that took on the burden, and it's a peer support. It's a, it's a phone number. You can call anonymously or give your name. We have a bunch of different officers that have been through quite a number of different issues during their career. So we had officers that suffered from alcohol abuse, that went through bad divorces, that got in legal issues on the jobs, that were in shootings, that were hurt very badly on the jobs and had to work their way through that. Just about any issue you can think of, there's kind of somebody in that group that might be a fit for officers to talk to, and it's that. It's a talking thing, and they also have some resources they can pass off these officers if they need something beyond what they're able to provide. So we're always looking for more resources and more input on those things. So if the CPC has anything that they can, any advice or any resources that they would be willing to talk about, we'd be more than willing to have that conversation. Sir?
Just wanted to add also that we're just started conversations with the Division of Police regarding the peer support that you talked about, but it was sort of that it would be that there would be one phone number to call that an officer could call throughout the whole entire county. And there will be peer supporters, let's say East Side, West Side, Central, like 4 divisions of, throughout the county. So we're just starting conversations with that. And part of it would include Carol Ballard working on training for the officers to how to act like a peer supporter to another peer supporter. And the folks who are kind of starting this, they are participating in the Ohio Department of Mental Health and Addiction Services peer support training as well. So it doesn't exactly fit with the officers, but they're getting a background of that, and then we'll be training the office for that. But we're just starting conversations about that.
Right, and just really quickly, it's really interesting the groundswell that, something like that was needed beyond very formal. Officers tend not to go look for help in a formal manner. Being able to talk to other people that experience the same problems that you might be going through seems to be a much better fit. So when we start to talk about things like that, it started very small, but now there's different departments are becoming involved countywide. People outside the county have expressed interest as far as down as Columbus, and they're looking at what that program looks like and what the uses are and how helpful it's been, and how some of the non-traditional type services that are provided there, as far as just being able to have a conversation with someone else that may have experienced the same problems as you, made it through to the other side, is so helpful to some of these officers. So.
Just one last thing I'll add is a couple of years ago we purchased a software system that is what I would call a personnel management system, and it connects all of the different aspects of an employee's work record. So if somebody is tardy, or if somebody is sick, or if somebody's missed in services or has behavioral issues, it takes all of those different aspects of somebody's work record and brings them all to one place, and it's kind of used as an early warning indicator that if managers start to see in several areas where an employee their behavior is changing, or they were punctual for 10 years of their career and all of a sudden they're late or calling in sick all the time, that is another tool that we're using department-wide that can give managers and supervisors kind of an early insight into there might be something going on with an employee, and then we can make referrals to the employee assistance program or other resources that may be available to them.
Any other questions?
Hello. My question was related to some of the mental health awareness kind of reform that the department seems to be undergoing. Is this targeted mostly towards civilian and police interactions or engagement, or does this extend to inmate and kind of mental health awareness within the jail system as well?
MHRAC was part of a memorandum of understanding between the City of Cleveland and the Adams Board, specifically to provide recommendations to the City of Cleveland and the Division of Police with respect to crisis intervention. At this point, we don't have any interaction with the jail system outside of the training that our officers get and the de-escalation and some of the diversion things that we talked about. We hope will reduce the amount of incarcerations for people that are in crisis. Because like I said earlier, in many cases, arresting someone and taking them to jail is not in their best interest or the community's best interest. So really MHRAC's focus under that memorandum of understanding is to try and find ways to divert those people when appropriate and get them the right kind of help that they need. But as of this point, we have no interaction with the jail system in that respect.
So I will say something about that really quick. There have been a couple offshoots outside of this process that have been positive for the community, but not necessarily falling under the MHRAC and the MOU. So Carol Ballard and her staff did develop some training for the county. Hasn't been implemented among all the county. Also, they developed some training for city employees that non-police. You might know the mayor was very involved in wanting to reach out to youth and get them some resources. Actually wound up putting social workers in all the rec centers. So they wanted the rec center employees beyond the social workers to have some training how to de-escalate people and recognize signs and symptoms of mental health and some verbal de-escalation skills. So Carol and her staff put that together. There's a really good training and quite a few city employees, both rec center employees and some of the other departments received that training, especially ones that deal with the public on a regular basis. It was a really good training. It's kind of a basic look at that, how to deal with people suffering from mental illness, kind of what are some signs and symptoms, and what are some strategies for dealing with those on a kind of a simple level, but very useful. And actually, she employed some people from the rec centers that had a lot of experience in dealing with individuals and had used some strategies in dealing with them for some of the scenario-based training. It was really excellent training. So.
Did you guys say that you only have one psychiatrist for all of the police? Did you guys say you only have one psychiatrist for all of the police?
Oh, psychiatrist. Yeah, so it's a stress consultant, it's a psychiatrist, but,
Wouldn't that be kind of overwhelming for the one psychiatrist?
well,
Wouldn't they
in
need
addition
one?
to our psychiatrist, we have an employee assistance unit
Okay.
that deals with a lot of those things, like counseling and ease at work and returning to work after injuries and things like that. So they do some of the lower level counseling and dealing with individuals, and then our stress consultant, our psychiatrist, deals with some of the higher end, some of the more crucial issues. So it's kind of a whole staff, and it's only one psychiatrist.
Is there kind of like some mandatory where they have to maybe see a person to speak to? Because sometimes your officers seem a little tightly wound.
Well, there's no requirement. Obviously, there's a psychological screening that's rather extensive before you get on the job. And as far as ongoing,
Right.
if officers are involved in critical incidents, yes, they have to see our stress consultant. There's a process they have to go through. As far as everybody, there's not like a yearly requirement
maybe possibly doing that? Because, I mean, just because it's there does not mean people will always take advantage of it. And
Right,
where
well,
there's,
we have moved in that direction a little bit.
okay,
So, when we have officers in some of these higher stress positions, so when we start talking about officers that see death a lot and see trauma a lot, so our homicide detectives, our SWAT detectives, our narcotics detectives, and if you know anything about the opioid crisis, they see a ton of individuals that overdose and die, and also like sex crimes. People are dealing with those type of things day after day after day. They get regular debriefs and things like that, especially after some major incidents.
okay.
That debriefing process. So that's something we moved into recently, and that having every officer like have a one-on-one or a group therapy or something of that nature every year is, I think, kind of the direction we're moving in. Like Rome wasn't built a day. I think that was a really good first step with having those particular units and some of those debriefing after critical incidents. It's sort of the first step toward that. So I think we have taken that step, and we're looking probably long run to maybe doing something.
Captain Purcell, can you please explain to the audience that when people call 911, they can ask for a CIT officer, and also explain what families should be prepared to tell a 911 dispatcher to kind of make your job easier?
Right, so.
Thank you.
Thanks. So, I think that's important to understand what CIT officer is and what they do. CIT officer stands for Crisis Intervention Team. A lot of people say Crisis Intervention Training, but it's actually Crisis Intervention Team. It's a team concept. Everyone gets trained. They get 40 hours of specialized training, plus many get additional types of training related to mental health issues. So I think if you're dealing with an individual, obviously for somebody that suffers from mental illness, whether short or long term, definitely ask for a CIT officer because they have received the training, they understand more types of mental illness, more about addiction, more about developmental disabilities and how to deal with individuals suffering from those conditions. And I think it's really important if you can say, I need a CIT officer, this person suffers from so-and-so. I think that can be very helpful because you're getting officers that have volunteered, that want to do this kind of work, and that have received additional training, and they tend to handle more of these calls. So those are all good things when you have a family member, a loved one, or somebody in your neighborhood that's suffering from those kind of problems. As far as what to tell the dispatcher to keep everyone safe, I think obviously we need to know if they have any weapons, if they've acted out in violence against anyone of the family, and if they have anything that they do that would alarm police officers. So do they have a weapon on them? Do they have access to weapons? That's something we always want to know. It's for everybody's safety. But also, it can be helpful to say what's been going on with them. You know, my brother's a long-term schizophrenic. He stopped taking his meds. He's starting to get paranoid, and now, you know, he's starting to act out. He's starting to act in ways that are alarming my family. Can you send a CIT officer? All those things are helpful, so the officers have some idea and some kind of plan when they go in of what they might have to deal with when they start talking to the individual.
One more quick question, even though I deal with accountability. The young lady had asked you about the psychologist, and you said it's a consultant. And if I'm not mistaken, did you say that they deal with like low-level stress of the officers?
No, actually, so she's a psychiatrist. She's full-time in the department. But we also have an employee assistance unit who are police officers that do counseling and deal with individuals that are under stress.
Not to interrupt you, just real quick.
They tend to do some of the lower-level stuff, and she does the higher-level stuff. Tends to be kind of where that comes out.
Okay, so how many officers is on the force between District 1 through 5? Would we say like 5,000 of the whole department? How many, okay, about 1,400, so you have one psychologist that deals with this one. Don't they think it should be one that deals with one per district maybe? Because you have one psychologist that's a consultant that's dealing with 1,400 different officers, and then she or he may not be dealing with them all at one time for different issues. But doesn't the department think they need to add maybe 2 or 3, or maybe 1 for each district?
You know what, you would have to ask her, I guess you'd have to ask her if she's overloaded or not. Because a lot of things are done by her, they're done, so some people have the option of going to a private doctor, some things are done by a stress unit, also called employee assistance unit, who also are trained counselors. So not everyone needs a psychiatrist, some people just need to talk to someone else, or need some resources. So I think she's not dealing with all the problems. She tends to deal with certain types of problems on the department. So I think there's other resources besides her. I love to have like a staff of 6 psychiatrists looking at I actually run out of lines and I'm looking at it.
No, I think the important thing is, though, she is part of a larger team. It's not just her and a couple of EAP people. There are multiple layers of services for city employees and public safety and specifically law enforcement. She's just one of those people. The city's had multiple contracts with other psychiatric, social work. They provide services for people that are going through difficulties at home, with marriage, with financial problems, with you name it. All of the issues that we all deal with on a day-to-day basis in this room, we've got resources for our employees to utilize to manage those things.
But you understand where I'm coming from, but the issue is from the past that we dealt with, that we're trying to deal with now, moving forward, so we don't have to relive it again. And this is why I'm asking those, I know they're probably tough questions, because we really need that. Because understandably, the consent decree is only here for 5 years. So after the 5 years, it may be gone. So we have to have something or a plan in place that we, like people like me, I lost a brother by a police officer. So, but I want to see it progress to a better level than where we are right now. And I'm asking these questions because if you got one psychiatrist that's dealing with 1,400 different officers, and I know it's not going to be on a daily basis, okay? I think, and I'm probably going to get some of the other family members, and send a letter to the mayor and to the law department, because I know it's going to cost money, but I'd rather spend money on getting a psychologist or a psychiatrist than have citizens to be in danger or even die, or even officers themselves in danger. So that's why I'm asking that question.
Yeah, no, I don't think anybody disagrees with that, but I think there's a bigger issue and a bigger process that we're trying to implement here. It's just, if Jim and I are partners every day, it's just as incumbent upon me to say something if I see Jim's behavior changing, as it is if you see somebody in your family that's struggling. To focus all on having a number of psychiatrists, yeah, that person can intervene for specific things, but it's really more about getting everybody involved and making everybody's priorities to make sure that we're all healthy and that we're all in the right mindset when we come to work every day. Especially in public safety, everybody's macho in public safety. All public safety people are running the places that everybody else is leaving. And it's not natural or normal for public safety personnel to admit that they need help. And so I think it's about changing that mindset along with all of the other things that we're working on that will make a difference.
You didn't just answer my question. I had the mic in my hand for about 3 minutes and you answered it. But Cleveland will benefit from this CIT. And what I'm saying is, it's only a split second and a split minute that can cause an officer or a resident that goes out, when the officer goes out to the resident's house, he doesn't have that long to determine are they mental health or not. So with that training that you guys are doing with the CIT and partnering with the Adams Board will help the city of Cleveland residents out crucial. Because it's a matter of seconds before they make that decision. And the CIT officer are already trained for the special body language of our mental health residents. So thank you.
All right, Mr. Rogers.
I just want to take the opportunity to thank everybody for coming out this evening to the commission's meeting. It is so important, and I heard some of the questions back and forth about the consent decree and some of the shortcomings that we do have. And you know, in any organization, we have shortcomings. The challenge is how do we fix those shortcomings, one. And then two, the whole purpose of the consent decree was because there was a problem here in the city of Cleveland as it relates to policing its citizens. And so one of the things that I would like to see after the consent decree is over with, that we still retain our commission. There still needs to be a level of accountability. And even though this room is not full of a lot of the citizens that are in the area, I do want to encourage the administration and those who are here, we need funding to get the word out. You know, it's only so much that can be done with elected officials, but the commission also needs to have the ability and the capacity to communicate these very important issues so that the community can come in, can get involved, can engage the process, and then that way democracy truly works for our people. But if our people have a commission that's not fully funded, then you won't have this room filled up. This room needs to be filled up, but this room is not filled up because you have not reached out to the citizens of the city of Cleveland when you're having these kind of forums. And so again, if you're going to talk about these very significant and important issues, it's important for us to have a commission that has the resources and the fundamental bagging of the city to put these flyers out here in the neighborhood. And if you do that, I guarantee you, this venue would not be able to hold all of the citizens who want to know about what's going on, who want to have an opportunity to engage in the process. So I just want to encourage those and those who have authority, who are here in the room, and those who have the power to please encourage the city of Cleveland to make the necessary investment in getting the flyers. If we would have had the flyers, I would have had a ground team go out, I would have pulled 1,200 out my pocket, and I would have spreaded those flyers throughout this entire neighborhood. Now, I know some people probably get mad with me making that comment, but at the end of the day, you need to meet me halfway. And then if you meet me halfway, if I'm willing to pull 1,000 and some change out to put the flyers out in the neighborhood, you should be able to at least to print those 10,000 flyers for me. And if you had to go purchase those 10,000 flyers, it would cost you about $1,100 at Zippity Print. And we could have had that throughout this entire neighborhood. It makes no sense that we continue to have these forums and shortchange the citizens of the city of Cleveland without having them here and being back and forth and understanding what's actually happening with the consent decree. And I can guarantee you one thing, the topic matters that we're talking about here today, none of these people know anything about it. So I want to be your partner, work with me so that we can partnership together so we can get the citizens of the city of Cleveland engaged in this important discussion. And that's about how we deal with the most pressing issues facing our police department. Thank you all for being here. And I'm pulling off my bandwagon. I really do appreciate all of you who have been able to make it, who are in attendance. And I want to thank the public servants who put a lot of their time, energy, and effort into this process to make sure that we're getting the right outcomes that we need to have. And again, thank you all for being here. And I also want to take the opportunity to thank Ms. Elaine Goldstein for allowing us to be a host here. So let's thank Ms. Goldstein of the Harvard Community Service Center. Thank you. Thank you, Ms. Williams.
Thank you.
Are there any other questions? This gentleman here. Sorry, can I?
I want to thank you for allowing me to be here this evening. I'm kind of new to the community, actually born and raised in Milwaukee, Wisconsin. And I'm hearing this conversation about crisis intervention. And that crisis intervention piece, for me, my understanding is that it's a threefold piece. It is the police's work, it is our work, but then there's also our work together. So that system of crisis intervention has to work from the inside out. And that means we have to work together first, and then as individuals go outside into the community and do the best that we can to make this thing happen. And that's my statement for tonight.
Thank you so much for your comment.
Hi, my name is Rosie Palfy. I'm a veterans advocate and a homeless advocate, and I've been on this committee since October 2015, so a month after it started. I'm going to try to be as diplomatic as possible. Everybody on the committee knows I've been very vocal about my concerns. I do want to recognize Carol Ballard from the Adams Board and Captain Purcell. They are tireless. They work their rear ends off. Karen Kearney, our community engagement subcommittee co-chair, she's wonderful. Great presentation. You made everything sound rosy, but the problem is it's not. The city started out really strong. They gave us Captain Purcell and hit the ground running, but they're spending money on the police commission. They're spending money on Office of Professional Standards. They have not given our committee any resources. They don't even pay for the paper to print out these reports. Excuse me. The consent decree calls for us to do an annual analysis. Our annual report came out January 31st. It is end of June. We have not convened a quality improvement meeting to even look at the data from last year. We, in almost 4 years, have not seen a single case study. We also have not discussed Tanisha Anderson, and I bring that up a lot. It is not about blaming the police or demonizing the police. It's about preventing another tragedy. I don't want to see a civilian or a police officer injured or killed in a situation like that. And there's so many things from dispatch to EMS, and there's a lot of things that if we looked at that could be improved. So I just hope going forward that's something that you'll consider. Also, Matthew Barge, the head of the monitoring team, he hasn't been to one of our meetings in 3 years. Deputy Chief O'Neill, who is wonderful, but she's extremely busy. She has not been to one of our meetings in 18 months. And Judge White, who's the consent decree coordinator, makes $125,000 a year, hasn't come to one of our meetings in 2 years. We also have, I think, Captain Simons here. I don't know if I said his name right, from the implementation team. He comes to these meetings religiously. He's wonderful. But I want to know why somebody from the implementation team doesn't come to our meetings. Like, I just feel like the way the consent decree was written, they put us in a silo, and we're not involved with the other areas with the consent decree. Also, I'd like to see the unions get involved. I know police officers have a lot of concerns, suggestions. So I just hope that's something the leadership will consider going forward. Thank you for your time. Thank you for inviting us here. I really appreciate it. Oh, Mr. C, did you want?
Good afternoon. My name is Charles C. I'm a member of the Cleveland Police Monitoring Team. There are 4 local monitors. I have attended, I believe, almost every meeting of the subcommittee. I represent the monitor, Matthew Barge. So to see me at one of those meetings is to see the monitor because he sends me to represent him. So the monitor is present, I report back to him, and I take my marching orders in that direction. So there is definitely a monitor's presence at those meetings.
Thank you. Any other questions?
Not only Mr. C, but Dr. Dr. DuPont is on the phone with us almost every meeting. My problem has been, if you will, my problem has been that from the inception of our beginning to meet
with the MHRAC portion is that there has not been a representation from our community. All right? All right, our first meeting, we had 100 people, and there were not 10 African Americans in the room. And this has been an African American problem. All right, so we have not been present ourselves to make ourselves felt in this portion. I can't talk about the other portions, but I can talk about this portion and the support that the Adams Board has given. The police department and the city of Cleveland has been very cooperative. We've had some very strong people put in some hard work to hammer out what we have accomplished. And it makes me sick for someone to stand up and begin to point fingers at people, because there has been some hard work and there's some tears have been shed in some rooms also behind what we have done. Thank you.
Thank you. Any other questions?
Hello, my name's Johnny Ham. I've several of the meetings I've been to, the commission has mentioned repeatedly that they can only make recommendations. They come back and say, well, we made the recommendations and someone at the city said no. However, we're not told who said no or the reason why they said no. I think it would be a really good idea if the commission would start doing that. That way we might be able to, as a community, adjust what we want to accommodate the reason why it was no, and to make it so it could be a yes later. Or maybe even better yet, how about the people that say no, you make them come to this meeting and explain to everyone out here why they're saying no. And then we can have that dialogue back and forth to maybe solve that issue. Additionally, the CPC and the monitors had the opportunity to win the hearts and minds of the community and the officers. Although, because of some internal bickering, some lack of follow-up and follow-through, I think you've all dropped the ball on this. When I was at the CPOP training last October, there was a representative for the monitors in the back of the room. During the training, I stood up, made a statement that ended with a question. The question was essentially, if the city has a history of not following through with new technology, financing, or technical support, why should we believe it will change when the settlement agreement is complete? After that statement and after the statement and that question, several officers actually cheered for that and clapped. The monitor that was in the back of the room, who by the way was internet shopping while this was going on, immediately left the room. Throughout the rest of that day's training, officers were being pulled out of the training or during breaks and being asked what it was I said and what the content was. Over the next day, the rest of them, the majority of officers, because most of them would come to me immediately afterwards and let me know. Nobody asked me. I'm the one that made the statement, and not one person came to ask me from the city or from the monitors. Because of that, my concern, I decided, you know what, I'm going to type out an email for everything that I said, and I sent it to the CPC through their website, and I sent it to the monitors through their website, and clearly identifying who I am and how to get in touch with me. And if you have any questions, here I am. Nobody got back to me. So here it is, I'm offering up an opportunity to have these discussions, and there is no follow-up, no follow-through. The last meeting, it was suggested that officers fear being involved in these meetings. I received a 10-day suspension for expressing my opinion, and the city held it against me for a promotion and a transfer. It took nearly 4 years and a federal judge to get back what was taken from me. Other officers see this and decide it is just better to stay silent, to stay under the radar is what they say. Additionally, why would they come to this meeting to speak when they will have their honesty held against them and potentially be verbally attacked like I have been at these meetings? At least 3 times, including the last meeting, I have been directly confronted for my job or for actually openly expressing my opinion. Each time the commission only intervened if I said something back. People in the audience have directed statements to me, and the minute I say something back is when somebody from the commission intervenes and stops it. And then tells them, hey, direct your questions to the commission, not to the people out here. This is not an encouraging environment for officers to come and openly express their opinions. Systemic failures in an organization cannot be changed by blaming those on the bottom rung. The CPC and monitors have become toothless dogs, and the systemic failures that you talked about correcting have simply just infected both the CPC and monitors with systemic failures of their own.
Thank you.
Are there any other questions for, wait, 1 second. For CIT or for MHRAC, for the 3 presenters so that we can have them sit if there are no other questions? Okay, thank you. We appreciate everything. Please take a seat. So normally we give 30 minutes to open questions and comments, and so we're well beyond that. But we're going to give 7 additional minutes for community questions or comments, and then at 7:30 we need to move forward with our agenda.
Okay, like I said, my name is Brenda Bickerstaff. My brother was killed by police 17 years ago. I want to encourage all residents to come out to the accountability workshops that the Cleveland Police Commission has every other Tuesday between 5 and 6:30 p.m. And the address is 3631 Perkins Avenue. And it's 3631 Perkins Avenue. And anybody can come. You could come even if no one in your family was affected by the police. Just come showing that you care, you're concerned, and you want to make recommendations. My second question is going to Lieutenant Ham. And Officer Ham has made statements that the Cleveland Police do not feel comfortable coming to these meetings. But Mr. Ham, no disrespect, you've said this multiple times. Why won't the officers come themselves? They can come to these meetings. This is what these meetings are for. We're going to agree to disagree because that's the only way we're going to be able to come to a common ground. I beat up Mr. Farmer all the time, and he still comes. He was asked to step down, and he's still here. He was asked to step down at the last meeting, and he's here. So just tell those officers to come. I guarantee you, tell them to come.
This is the point I was making.
Yeah, tell them to come.
I'm directing it to you, it's her directing it to me about other officers.
But why can't they come?
I can only give you my opinion about those officers.
Okay, but why don't they come?
So, Ms. Bickerstaff and Lieutenant Ham, I understand, and I think she's asking a question and making a suggestion. So, true. Right. So what we can do is, this is the thing. If we have a suggestion to give to a person, ask them to the side and offer that suggestion. Otherwise, people have the right to feel like they are attacked. So
Okay,
you have to respect a person's opinion. Okay.
Huh?
So wait, we got to go to the next question. Right.
Okay. How many people like community theater that's engaging and enlightening? Hold your hand up, please. Community theater that's engaging and enlightening.
So is this a question specific to CPC?
No, it's not. I thought this was open mic.
It's for Community Police Commission concerns related to the consent decree.
I was invited here by Dr. Connor.
I understand that, but I need to be clear about what our purpose is here. We can't use this time for promotions of personal
Okay,
endeavors.
it's not personal. Let me turn it around. How about that? How many people think a thought-provoking play would help attitudes in the community about police and black community relations? Okay.
Okay.
Thank you.
Okay, thank you. Are there any more questions specific to consent decree, CIT, CPC, safety? I mean, something relative to police reform? Okay, Mr. C.
I hope it's relative. I just for a moment of clarification. The monitoring team has conducted with officers from the Cleveland Police Department a series of sessions at which officers could share feedback, share their concerns, and give their opinions about policies and practices. And we've done that twice this year. The consent decree calls for it to be done. We will continue to do that. Officers have an opportunity. We conducted focus groups across the department, diverse focus groups made up diverse racially. They were diverse in terms of rank, years on the force, et cetera, et cetera. So officers do have an opportunity to give feedback, and they have done that, and that feedback is then given to the command staff throughout the department. So we've not encountered officers who are dissuaded from giving their opinions about what they experienced, what they had. The confidentiality of those officers were protected, and they participated eagerly, and we did that over a 3-day period. We've done it on 2 different occasions. Thank you.
Thank you. So it's 7:28. We have 2 more minutes of questions. Are there any additional questions?
I was just wondering if there's still any discussion or possibility of the mini stations being reinstated? Is that okay or no?
That's a great question to ask. I don't know if anyone on the commission can answer that question.
Oh, okay.
I think that's maybe a question for city council. Wasn't that where it was proposed? So you might want to go to the city council meetings. I'm sorry.
Cool.
Anyone else? Okay, well, thank you, as always, for a lively debate and discussion. We welcome all comments. It's important for us to understand that collaboration is key. We're not here to agree. We're here to try to work on developing solutions that promotes community trust, are towards police reform, and of course, is going to promote the safety and security for not only the citizens, but for all police officers. So with that being said, if you have additional comments or questions that you didn't have the opportunity to share here or did not feel comfortable sharing here, please write it on a piece of paper. You can give it to any of our staff. Mr. Goodrick, our executive director, Janita, who's sitting in the back and assisted you with refreshments, Ms. Shelley, who's passing around the mic, or Ryan Walker. They will be happy to take those, and we will respond to them as we receive them. So now we're going to conduct a little business. We have the review and approval of the March and May meeting minutes. So we'll start with the March minutes. If I can hear a motion for approval.
So.
Is there a second?
A second.
Vote.
Chairs can't second.
Can't second.
Sorry.
We need a non-chair second. Second. Okay. And we vote. All in favor? Aye. All right. Any opposed? Thank you. So moved. For the May meeting minutes, we need a motion for approval.
So moved.
And a second. Thank you. All in favor? Aye. Yes. Okay.
I noticed when I went up on the website today, there were a lot of changes that were made to the minutes, but there was no final form of minutes. So how do we know what we're voting?
So that wasn't sent out? I thought, I saw the email, so maybe everyone did not see the email, but I'm sure you replied on it.
The Google document that had minutes, there was things crossed out, items read. I didn't see anything that was final.
Okay, so we can hold that, because I saw the final, so I guess we can hold that to table at the next meeting.
Minutes that haven't been finalized. They haven't been finalized first.
Right, I'm saying I believe I saw a finalized document, but if everyone did not, then we'll table it to the next meeting. Okay, so next agenda item is an update from our executive director, Mr. Goodrick. May. March.
Good evening, everybody. My name is Jason Goodrick. I am the executive director for the support staff of these volunteer commissioners. For those, I see a lot of new faces here. For those of you who don't know, these members are volunteering their time. Some of them, 3 of them are 2 who are present, Jeff Fulmer, and Sergeant Jackson are full-time employees, but they are not compensated for their time on this board as well. So these are all volunteers. So I always start by thanking our volunteer commissioners, and then our staff as well. We have support staff here. They've been walking around introducing themselves to everybody. Any additional questions or information you'd like to follow up on, you can give it to me or some of our support staff in the room. So thank you, staff, as well. Ms. Bickerstaff, who participates regularly, has already mentioned our community meetings that occur on, I believe it's the first and third Tuesday from 5 to 6:30. That kind of hone in on some of the issues that are talked about here, specifically in relation to what we would consider accountability for the consent decree. It is an open public join in, have in-depth discussions to help build recommendations that are currently ongoing, which is our job. So again, the first and third Tuesdays, 5 to 6:30 p.m. We are also looking at, in the future, adding some people to specifically look at things that need to be revisited from the past, including the disciplinary matrix and the disciplinary policy. So if you are interested in that, this is the group to come join up. So if you're interested in that issue specifically, let us know, and especially if you have anything in your personal life or professional life that has dealt with that in the past. If you were an HR professional, an employment labor lawyer, this is a great group to get in. Also, if you want to get a hold of us to let us be known that you're interested in these groups, the web address that you would want to send that to, the email address is info@clecpc.org. So if you go ahead and do that, info@clecpc, you can send us an email directly and we'll respond to that. And then one last point, we do have 2 surveys on the table. I know it can be daunting to answer questions. One of the survey's purpose is to find out who you are so we can know how good of a job we're doing reaching the community. And the other one has some specific questions, very short, for the accountability group. So if you can remember to return those, you can either get them to me or another one of the staff members as well. Thank you.
Thank you. So Commissioner Maxwell is not with us tonight, so we will table our budget update into the next meeting. If you have any specific questions about our spending, expenditures, or our current budget balance, you can contact Mr. Goodrick and he can provide that for you. So that takes us to announcements. So we have the accountability forum, which is coming up July 17th at 7 p.m. This forum is in collaboration with SURGE, the ACLU, and PRISM, and the purpose of this conversation is to discuss community concerns and issues related to accountability. This is not a focus on discipline. Discipline is too late. Accountability is an early warning system that puts in place an emphasis on implementation, supervision, and how we can support officers to better do the mandates of their job. So if you would please put that on your calendar and come out, North Presbyterian Church, 4515 Superior. We also have ongoing Common Ground Library talks on various dates. You should have received the handout on the table that looks like this, and it's also on our website. So I went to the one in Huff, and I plan to attend as many as I can. I would love to see you there. There we can have a more personable conversation about all matters of police reform and community issues that maybe we have not addressed and aren't paying attention to. Remember, it's 13 of us and we cannot think of everything. So if there are things that we are missing, please give us the assumption of good intention and work with us to increase our knowledge of what we need to know to support the community. And finally, our save the date for the CPC quarterly meeting on September 17th. And you can check our website for the exact location. Our website is clecpc.org. And with that, I'll open it to commissioners if they have any questions or comments. Seeing none, I think we are adjourned. Thank you, everyone. Have a wonderful evening.